Performing 3 tests on the knee joint. The first one we're going to do is called the McMurray's test, and we're just testing the medial and lateral meniscus. So do I have permission to perform these tests on you? Okay, so what I'm going to do is I'm going to bring his knee up into flexion, so just relax. We're going to ensure that we have our hands on the joint space over those menisci. I'm going to put him into internal rotation, which is going to test the lateral side, and we're just going to bring his knee down straight, feeling for any crepitus, popping, cracking, or any pain. Did you feel any pain with that?
No.
No? Okay, so that's a negative test. A positive test would be seeing any of those symptoms. And then the next one is just doing it with a lateral rotation or external rotation, keeping our hands again on that joint line, bringing the knee down to straight. And there's a little bit of cracking stuff, but it came from underneath the patella, so that's not relevant to the meniscus. So again, a positive test would be any of that cracking, crepitus, or pain on the client. So the next test is going to be a Patella Apprehension test. So it's just going to be a medial and lateral glide of the patella, and we're just kind of watching the athlete's face to see if they suffer from any pain with this.
It just tickles.
So we're just sliding it back and forth, and they might tell you that it feels like it's going to give out or sublux again, and that would be a positive test for that. The last test we're going to do is the brushstroke test. So it's just testing for any swelling inside the joint capsule of the knee. So you're just going to rub up the medial side a couple times, coming up and around to push that swelling kind of into the joint, and then you come down on the lateral side, looking to see if there's a bulge right here that would be a sign of that swelling, and that would be a positive test, but he didn't have it, so it's negative.